Federal health officials consider it an epidemic, yet you rarely hear a thing about it. At first, it seemed to strike only one segment of the population. Now, Barry Peterson tells us this is no longer the case.
Acquired immune deficiency syndrome.
HIV virus that I have.
I was HIV positive.
Suffering from full-blown AIDS.
70,000 AIDS-related deaths.
Younger people can't relate to AIDS the way that we relate to AIDS. You can lead a normal life. You can live a long time, die of something else. That didn't exist then. So we were the first organization to come together and open a nursing home for addicts that had AIDS.
It was a human catastrophe in the city. The real issue was that people were coming in very, very ill and very, very hopeless. They knew at that point that they had AIDS, and they had assumed they were coming in to die.
When I got here is when I realized how much of the AIDS crisis was affecting people of color, women, people who were IV drug users. And the medications were not adequate, although they were trying very hard.
One of the models that was being used was called the therapeutic community. It seemed to me that that mode of treatment was the most effective. That's something that, a treatment model that incorporates the clients or residents into the structures.
Therapeutic communities were wrestling with what to do. And that's where they worked together, which was again remarkable at that time. They worked together to devise this new model.
The president of Project Return was Jane Velez at the time. So we started talking about how we could possibly get together as two organizations. Let's open something up that is less demanding on the client. So the person could stay in recovery, stay in treatment. We had a friend, and our friend was Andrew Cuomo. He had been an assistant, $1 a year assistant to his father, the governor, and he was in fact very helpful. We started building this building.
So my sister's name is Marilyn Cruzado. She was one of the first female coming to help PSI. My sister was an IV drug user. In 1990, she was diagnosed with HIV. She ended up in the hospital with PCP, pneumonia. And that's when one of my colleagues had mentioned Help PSI. Somebody from PSI went and interviewed my sister in the hospital. I want to start crying now. And she got accepted, and it was the best thing that ever happened to her.
I had an interview in early winter of 1991, and I came in to meet the nursing director, Eileen Pagan, and I walked into the front of the building, and as I was getting directed to her office, which is in the current administrator's office, somebody right in front of me in Front Point had a seizure. And you know, I immediately started taking care of the person, and I actually used an acupuncture point right here to control the seizure because obviously I didn't have any access to medication. And he was okay, and he went back to the clinic, and there weren't any other doctors there at the moment, and Miss Pagan had watched the whole thing, so she said, "You're hired."
I'll never forget, it was a nice day. I was coming from the Bronx Supreme Court. I was legally mandated. I was coming from 161st Street to here. And they brought me, the driver at the time was Frank. He drove me here, so he was driving. I've never been here, I never knew anything about PSI.
Back in 1995, I was diagnosed with HIV. So I was actually in prison when I found out there was little education, little to be known about HIV, and this place was open. I think it was already open 4 or 5 years. I really came here with the belief that this was my last stop.
It was so much different than it was now because the AIDS epidemic, all the medications they had back then was new. I'm not even sure if they even had AZT back then. And it was kind of like a learning process.
July of 1996, I got arrested for a drug sale. There was a young lady there who was interested and was talking about PSI. I did not know anything about PSI. Still, I was afraid. you know, and I think more so I was afraid just because I had to identify with the fact that I had AIDS.
With the addiction, we're still a child because we stopped growing the first time we pick up drugs. And when we put the drug down, that's when we start living again.
They teach you how to get back into the workforce if you choose to, how not to take advantage of your own natural skills.
You know, if this is the way I have to tell others that it does work, then so be it. Because, and I thought about it, you can't keep something that was given to you. You gotta give it away, you know, and let it be known that there is hope and that there, you know, are people out there that do care.
The most exciting thing for me that lets me know that I'm doing my job well, is when I refer another resident to another agency and they become a staff member. So these are the kind of things that, like, yes, you know, makes me feel really great.
When I often talk with clients, that's what they would say to you. This was family. So that resonates with me.
I just love every aspect of what I do. It's a delight getting up in the morning and coming here.
It's really very, very corny, but you know, we save lives. That's what we do, we save lives.
It's been a human endeavor to respond to a human catastrophe. And it meant learning together, it meant suffering together, and it meant having joy together.
People are put here for special reason. You may never know what the reason is, but it generates from one person to a whole community.
I would say it's about gratitude, because I'm a graduate of Samaritan Village. So being here kept it green for me.
I love what I do because I know that in my life, when I look back on this part of my life, that I will have done something really important. I feel that way about this work.
And the most of all is waking up and knowing somebody cares. You know, that's the biggest thing to me. You know, but the hope for tomorrow, that there is hope.